We had a great session on breast cancer screening in Europe. My talk was going to explain the discussions that are running around breast cancer screening. I made several points very clear. First of all, we are talking about organized, quality-assured programs, not individual screening. And when we talk about programs, we know that there is an invitation, that it goes to all women, that it is an equal possibility for everybody, and that it has a very fixed quality assurance by double reading. In contrast to individual screening, that means some women will go to see their doctor and they propose to make a mammogram. In this setting, the quality assurance is missing and also the equity for all women is missing. In some countries of Europe, these programs are running since years and have been shown to be very efficient. Efficient means, like here in Holland, we are in Amsterdam, the Dutch have been running such a program since years, and the breast cancer-related mortality has been reduced. Now, in some other countries where the healthcare system is different, where there is more decentralized and more private medicine, people are discussing a lot because, for sure, a public health program like a cancer screening program will interfere with a lot of interests. Some of these interests are never pronounced when we are talking about the data on breast cancer screening. You may know that some authors, 2 or 3, are always repeating the same thing and saying there are problems. But these people never say what their real values are. Because if you offer something to all women above 50, you can also say we want to do and put our money somewhere else. I think the value is important to take care of women and the most frequent cancer in women at that age. I think the value is there. I'm convinced that this is important. But I also want to see that people who are making a fuss about it say why. I know that in some places it is just a financial interest to say we don't want to have it in a program, but we want to do it in private. Some people also want to put the money somewhere else and start to argue that the life of a woman is not so much worthwhile. And my talk was, please be very clear about your values and what you want to say. The data are clear. Breast cancer screening in an organized way can reduce breast cancer mortality. If you're going against or you want to change something, please make sure why and what are your motivations. That was kind of a resume.